One of the most obvious causes of obesity is so-called insulin resistance. This is an elevated level of insulin in a person's blood, which leads to the person feeling constant hunger. They want to eat, they don't feel full from their usual portions of food, and they constantly crave more and more sweets. And at the same time, they start gaining weight. And this vicious cycle of insulin resistance, hunger, and elevated insulin is very difficult for a patient to overcome on their own. And these symptoms, when a person doesn't feel full, when they are constantly looking for something sweet, can be the first warning signs of obesity. For example, they are very often seen in children. Children who are used to constantly eating sweets will then keep asking for them and keep gaining weight. Unfortunately, there is currently no clearly formulated cause of obesity in the world that has an absolutely clear, evidence-based scientific foundation. The generally accepted opinion that the cause of obesity is a person consuming more energy than they expend is just a theory. This theory has not yet been proven, however, it is used by the majority of doctors as the primary method to explain to a patient why they are overweight. However, there are many other theories and many other causes and risk factors that lead to obesity. And yet, the main one is insulin, a disruption of insulin metabolism. It affects obesity in the most direct way. And often people gain weight not because of how much they eat, but specifically because of what they eat, namely products containing a lot of sugar. First and foremost, obesity is a disease. It is in fact a serious disease that many people do not perceive as a legitimate medical condition. This is a problem for both the patients and the doctors who treat them. But it is important to understand that, despite the fact that humanity is currently living in an era of various diseases, obesity is, after all, an epidemic, the epidemic of the 21st century. Because when there are 2 billion people on the planet with obesity, and more than half of them are overweight, it becomes an unbearable burden for the healthcare systems of all countries, without exception in the world, even developed countries such as the USA and Western Europe. Obesity is not just a simple disease. It is a serious medical condition that, much like a powerful magnet, actively attracts a wide range of other illnesses. It serves as a direct and primary source for many of them. Today, obesity is the number 2 risk factor after tobacco smoking for the development of oncological diseases. It is the number 1 risk factor for patients with diabetes mellitus and many other diseases.